given where we are today, where are those new to our rural areas to help leapfrog and get those services to where they are needed? And if you go by that, I think even the move towards universal health coverage in the long run would then have the essential building blocks, because you are doing it based on certain priorities around key objectives of the health system.
Thank you. Thank you very much, Dr. Pate. You've steered us really in the direction of understanding the biggest causes of mortality, I think, for us in Nigeria and the rest of Africa, really those vaccine-preventable diseases, the AIDS, TB, malaria, the maternal-related mortality, perinatal conditions, and all of that. I want to go to you, Honorable Minister of Health for Ghana. We've heard about the challenges in implementation related to having poor human resource and having poor mechanisms for behavioral change communication. We've also heard about where the major gaps are and the causes of mortality. Do you have any additional gaps you can comment on? I've heard you speak before, and I know you're big on leadership, and you're really big on African governments really taking a major stake in sort of driving all of this. Can you tell us more?
Thank you very much. Thank you very much, and I also want to share my voice to the missing girls. You know, we pray that they'll be found, you know, safe and returned to their parents. Yes, my colleague spoke about human resource development, which I think that it is very important, because if you take the health sector, the health sector is so dynamic that you need different, you know, skilled labor just to deliver health care. I mean, when you enter a hospital, you need a nurse, you need a laboratory assistant, you need a technician, you need an X-ray, you know, diagnostic team. Before you even see the doctor, then you move to the pharmacy, and then you are sure that you come out of the hospital knowing that you get back home well. And I think that most of our educational, you know, policies, you know, are, straight jacket. I mean, we've inherited, you know, policies from our colonial masters. You know, education has not been tailored, you know, to produce skilled labor. You know, so invariably more people, you know, go to school, more people go to the universities, but they come out as just educated. You know, and I think that if we want to look at the health sector, then we must prioritize what we teach in the schools. Especially, we must increase the teaching of science and technology. I mean, if you take the average, you know, population of students, about, 70% will be doing the arts, you know, and you find very little people going into science and technology. So it is very important that we should look at the educational mix to give them the platform, so that we can then train them into nurses, midwives, laboratory technicians, doctors, and so many things. So we also have the same problem in Ghana, especially where we have 1 doctor to 1,000 patients. So it's so difficult to get a doctor to go to the rural areas, out of reach areas. Yeah. So this is where we form partnership with civil societies and NGOs. And recently, we have also signed, you know, memorandum of understanding with the faith, churches, you know, because in Ghana, the, religious organizations operate more than almost 250 hospitals in out-of-reach areas. And then the churches are also, willing to put in some resources. So government and the churches, we are working together so that we can provide accessibility to the poor. But I always continue to say that it is very, very important that government prioritize health, on its budget. And there's always the need that health ministers and the ministers of finance, we need to sit down, to talk, because you can take, technology to the remotest area, like maternal and child, mortality programs that we are, implementing in Ghana. We can send some, new technology to a village. But for a pregnant woman, even when, she has been diagnosed that the person needs, urgent, perhaps surgery in the city, the road between the village and the city hospital is so terrible that sometimes some of them deliver in tractors. Or by the time they get to, the main town, they've even died. So we have a complication, of so many things. And I think that, I always think that the private sector, the civil society, the NGOs and government must always work together to understand what we can provide in the health sector.
Thank you. I think what you've deepened the comments that we heard from our last two speakers, and you've taken it further to explain how this can't be done by government alone. It needs to be done in partnership with the private sector and with civil society, really to get to those peripheral areas. And I think it's a good segue to talk to our friend from the Gates Foundation. Mark, you're the head of advocacy at Gates. You all are the foundation. Earlier on, I think it was Mikkel in the audience called the Gates Foundation the foundation. Clearly, you guys have a major commitment to funding health, and I applaud you for that. My question then for you, Mark, is what's your take on some of the points we've heard from the last speakers, and how is Gates prioritizing its investments in the context of where the gaps are in Africa? The second question, if you could just take them one after the other, is what innovations are you all supporting? What innovations do you all think will work for Africa?
Great. So, well, first, thank you for the question to the World Economic Forum for hosting this, and let me also add, on behalf of Bill and Melinda Gates personally, but also the entire foundation, our thoughts and prayers with the missing girls and their parents, and indeed all the people of Nigeria, hoping for a safe return. On the issue of health more broadly, we take a fairly simple approach, which is we look for where is the highest impact intervention in terms of lives saved per dollar spent. It's a very simple equation. And that leads you in Africa, and indeed in much of the developing world still, to infectious diseases, which are still the primary. While there is an epidemiological transition underway for Africa, the primary causes of death are still the major infectious diseases, HIV, TB, malaria, and the preventable child diseases. And so that leads us, at one level, our biggest sets of investments are in vaccines, and I won't speak to a great deal of that because Seth can talk to the wonderful role that Gavi has played in accelerating the spread of vaccines across the developing world and the enormous impact that's had in terms of lives saved. But more broadly, it's also about an argument, responding to the minister's observation that this is a conversation that needs to include finance ministers, and it needs to include other parts of government to realize that these investments are not just to do good things for your people. They are fundamental investments to do good things for your country and for your economy. And in fact, we helped support a recent commission, the Commission on Investing in Health, that the Lancet magazine hosted, and there's some flyers out front, which is arguably the most rigorous assessment ever performed by a committee of very distinguished economists, health practitioners, ministers, and others, that says conservatively, their most conservative estimate was that there is a 9 times return on investment over time to investing deeply in these health interventions, and the optimistic one is up to 20 times. And that's looking over the long term, which is often difficult to do because it's the life saved now, the child who's then able to go to school, get educated, the healthy parents who are able to look after them and stay employed. The ripple effects of that are absolutely enormous and not often understood and internalized, and we don't think often sufficiently prioritized in terms of financial allocations, either at a global level from donors or domestically within domestic finance. Within that, again, I say we look for technologies. There is, and part of the theme, there are technological breakthroughs, and those are important, and can they be, is it in the form of new vaccines? For example, one of the ones that we helped work with and pioneer was a new meningitis A vaccine, which is now, I think it began to be rolled out in 2010. It's now reached 150 million people across the Sahel zone. With another 2 years, there'll be another 140 million people vaccinated. That's success in a very rapid pace of time at scale. But then there are also innovations in delivery. The minister, the Honourable Minister from Senegal, has got some very innovative plans on family planning and the distribution and networks of supply chains and supply chain products that we're working with her government on in Senegal. And those are kind of models that are also applicable to the delivery of other goods and services. And they're also models about how you train and utilize community health workers, and some of the lessons from countries like Rwanda and Ethiopia that have had enormous success in recent years, using relatively modest expenditure to relatively high return, again, in terms of lives saved. And you need the whole complex ecosystem coming together. And as the foundation, our investments are really about supporting the national governments across Africa to develop those plans, to implement them, and hopefully our resources and technology and advice can help accelerate that impact.
Excellent. I think the ministers here are probably happy to hear that. It's always good to work with the national plans, and I'm glad to hear that you all are doing that at Gates. Seth, we've heard from Mark about the priorities of Gates, and clearly Gavi is a #1 priority, perhaps, if not #1, it's up there for Gates. And we know that life expectancy is low in our region. In fact, there's an 80% chance of living to the age of 80 in the US, and in Africa there's a 10% chance of getting to 80. What is Gavi doing about that? What kind of impact is Gavi having in solving these issues, vaccine-preventable diseases? That's the first question. The second one is, what types of innovation are you applying in your behavioral change communication? Because we see that that's really critical to be able to have access and impact on the patients, is that they need to be able to receive a message in such a way that it's not offensive and it actually leads to positive change. So what impact are you having, and what are some of the innovations you're applying in terms of your communications as well as your training?
So thank you, Akudo, and let me also add my solidarity to the missing girls.
Well, that is the plenary titled Investments in Health. But we'll now take you to another one, Partnering for Prosperity in Africa. And the President Goodluck Jonathan of Nigeria, is attending that session.
But because the different countries in ECOWAS are different levels of development, and out of the 15 countries that make up ECOWAS, of course, the economy of Nigeria is, with the rebasing, it's almost 60% or even more. And also the local manufacturing companies, even though it's still low, but compared to other countries, you see that manufacturing in Nigeria is much more higher. So we have these problems of agreeing on some of these tariff lines. Of course, that is